Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about perineal tendonitis. We're going to do this the same way with the 4 different questions. Number 1, what is perineal tendonitis? So the perineal tendons are tendons on the outside of the ankle. We call them the lateral side, and those tendons go right around the ankle joint and attach to the 5th metatarsal, at least one of them does, in the area that's usually a little bit prominent on people on that outside of that foot, the 5th metatarsal area or styloid process. So what happens is, if you overstress that tendon, if you start to have issues with that tendon, you actually get a perineal tendonitis, or an inflammation of the perineal tendon that causes pain and discomfort, and usually is pretty problematic. Number 2 is, why does that happen? Usually it's an injury. Usually you're going to sprain an ankle or twist an ankle, and instead of having an ankle sprain or a fracture, you get an injury to that tendon and create a tendonitis, or pretty significant discomfort in the ankle or in the foot where that perineal tendon runs. Ways that you walk can also cause it, but really it's usually an injury. Number 3, what can you do for it at home? The recommendation is to treat the inflammation, treat the discomfort. So if you say, okay, what I'm going to do is I'm going to treat the pain, I'm going to treat the swelling with ice, anti-inflammatories like ibuprofen, and then you're going to go from there and see how you're doing. That's a pretty good option there. And then the 4th thing is, when should you go see a doctor? If the symptoms are not improving, if you're saying, okay, it's getting worse and I'm not sure what's going on, we evaluate ultrasound and determine if you have just a tendonitis or if there's actually an injury and tear to that tendon. So perineal tendonitis can be a big deal, or it can be something minimal that actually resolves pretty quickly. It's Dr. Brandt Gibson, and this is your Podiatry Tips Day 168, Perineal Tendonitis.